Welcome back to the ClintrixAI Podcast, where we explore the intersection of healthcare, innovation, and business transformation. Today, we're talking about a topic that's reshaping healthcare as we know it, telemedicine. And joining me is someone who's been pioneering this space long before it became a buzzword, Kyle Rao, President and CEO of Secure Medical and the founder of Telehealth Cash. Today, we're going to be speaking with Kyle, who has over 25 years experience driving innovation in this industry, from building one of the very first online prescription platforms to now leading a white label telemedicine ecosystem that's empowering others to launch their own healthcare businesses. We'll be talking about how telemedicine is evolving, what's fueling its explosive growth, and how vision, not just technology, is shaping the next era of patient care. Kyle, thank you so much for being here with us.
Thank you very much for having me. Today we're going to discuss a new project of mine. It's called Telehealth Cash. Now, I know it can be tough to leave your business in someone else's hands as you attend new conferences and you leave your families, you're heading out to other networking events with a bunch of strangers. But what it really comes down to we are all strangers. So we're all here for the same reason, and that's to discuss what the future holds and how to make money by embracing change, especially with the AI boom. So first off, I'd like to say thank you for being here, and I hope that you enjoy my presentation. And second off, I want to make sure that it's worth your time, because time is one resource you can't buy. Every moment does count. So I'm excited to be on this podcast, especially talking to individuals that are driven by curiosity, ambition, and have a passion for innovation. I'm glad to be around well-minded thinkers with fresh ideas. Together, we fuel collaboration and open doors and opportunities that wouldn't exist otherwise. Over 27 years ago, I placed a small ad in the back of the USA Today magazine. It was just a phone number and a redirect to a splash page called viamedic.com. From there, we advertised in those penny savers, the LA Times, and towards the back page of those magazines like Popular Mechanics, Golf, Automobile, and more. Honestly, I'm not even sure these magazines exist anymore, but I really do miss those days of flipping the pages. But unfortunately, now I scroll up and down and side to side on my iPhone mini, and that's how I get my reading in. So we were the very first company to sell Viagra over the phone and online using a telehealth consultation with a remote doctor. After the first few months of business, Secure Medical was established. A few years later, we experimented with the kiosk, as you see here, this fully functional telehealth portal, or spaceship, I like to call it. My vision was to have a kiosk placed in strategic locations so people could see and experience the future of healthcare. But spoiler alert, it's now a very expensive paperweight in my office, and I walk by it every day. But why does this happen? Why do things move so fast?
I do have a question before we move on.
Absolutely.
So, what first inspired you to get into this space, and how did your early experiments like Biomedic and the kiosks shape your journey?
I knew that there was a need. When the product came out, I knew that this was an embarrassment product. Not a lot of men want to go to the doctor and discuss this ailment because it's a very embarrassing ailment. And so we wanted to provide them the same type of consultation that you can get from a remote doctor. And with that, the kiosk came along. And that was, after we had added a few more medications. So we started to add lifestyle medications such as hair loss, weight loss, antivirals, and typical lifestyle medications. And, we wanted to use the kiosk so people can get, let's say, antibiotics as well from a third world country, as you just can't get to a doctor. So that's how you would get your prescriptions written and so forth, and take that to your local pharmacy, and it would print you up a script right in the kiosk. So you finish the consultation, print up your prescription, and you're off to the races.
I think it's really insightful. I already called you a pioneer, but I would say that's why you're a pioneer in this space, to be thinking of solutions to problems like that over 20 years ago. What would you say were the biggest lessons, your initial experiments, especially with the kiosks? What were the biggest lessons you learned from that part of your journey?
We grew a little bit too fast with the kiosk. There was a big device, as you see here. Months later, the kiosk was maybe a quarter of the size. It would be on a stand, and then you would have the area to print up the prescriptions and all the machines to check vitals. Okay. So the size of the unit just got smaller until now we use our smartphones.
Oh, I see. I see. I see. Well,
And
thank you
that
so
came
much.
rather quickly. I mean, when we had started this, I believe I was still using a pager. Remember those days?
And now you use your iPhone. How time
Ex-
changes.
yeah, yeah. All right. So now to continue, technology did catch up to us. The high-speed internet, smartphones, the video and cloud-based platforms were created. The COVID-19 pandemic, we experienced excellent growth during this time as people had no choice but to use a telehealth solution at the time. Regulatory changes, governments and insurers relaxed rules around prescribing, including licensing across state lines and reimbursement. Convenience and demand. Telemedicine saves time, no more traveling to the clinic or dealing in those long waiting rooms that nobody wants to be in there. But also my favorite, the cultural shift. The moment that people tried these virtual visits, everything changed. Suddenly, it felt normal. And the younger generations, healthcare is not just another on-demand service right up there with Uber Eats and Amazon Prime. So they're comfortable of using that now. That's how the times have changed. Now, let me ask you this. Have you ever dreamed of creating and owning your own online healthcare platform, but thought it was just too complicated, too heavily regulated, too expensive? What if I told you it could be easy as launching a Shopify store? That is exactly what telehealth cash is all about. Most people think healthcare is off limits. They think it's
Mhm.
endless paperwork, compliance headaches, and costly infrastructure. But here's the secret. We've already done all the heavy lifting. I'm proud to say that my team and I have decades of experience. We've executed countless pharmacy partnerships with extensive doctors' networks, including compliance systems built from the ground up. All of it is already done. You just plug and play into our model. So think about it. Why not let us handle the legwork? All you do is bring us your brand, your vision, and your customers. Sit back and enjoy what really matters: your family, your boating, your vacationing, and just watch and see all the money you'll be earning using our dashboard. And imagine launching your own telehealth platform in about 2 weeks. We need about 2 weeks to get that going, and seeing your vision come to life without the unusual healthcare headaches and hurdles. Now that's the power of telehealth cash.
That's a really great idea. I do have to ask though, what inspires this model of business and how do we balance profit with patient safety? Because like
I'll
you
get
said, I think people tend to sorry to call you, but I think people tend to shy away from healthcare. Like you said, it seems complex. You all have on the slide, you need a degree, degree headaches, worrying about compliance. So how do we balance all of that with
I'll,
profit
I'll
at the
I'll
same
I'll
time?
get to that. I think
Okay.
it's good to know the lifestyle approach. If you go to the next slide, this is how you want to
Yeah.
capture a customer. So you want to get the customer when they're 18. Start at a young age. Typically at 18, they start with acne and skincare changes,
Hmm.
and they need help. So we could provide treatments like topical acne meds, hormone therapies, vitamin supplements, and more. Then by 25, 35, hair and wellness take stage. Uh, Past wins spark curiosity, is what I like to
Hmm.
say, encouraging them to try new hair growth treatments, fertility supplements, vitamins, and prescription wellness meds. All right, so you have that customer coming back years later. You've built that trust with them with that first order at 18. At, let's say, 35 to 50, now life gets busy. You discrete ED and weight management programs is something we offer. Handle that with testosterone therapy, weight loss, prescriptions, chronic healthcare medication. You turn that loyalty and engagement into a long-term subscription. So that's maybe answer your question. Why get these business? Because it's not a one-off product that they buy and then they don't come back. We want these businesses to come in and say, I like their model because I could see my customers using this in their lifespan. We can jump to slide 6 because I guess you get the point there. We want to take your company on the journey of life, prescribing, handling ailments, and getting you comfortable speaking to a physician's network in the comfort of anywhere in the world. Any questions?
I think you already touched on my question, so I'll let you go on with the
Sounds
presentation.
good. Sounds good. So now the pain is real. Your customers are already waiting for telehealth solutions. This is a chance to join Telehealth Cash and reward yourself by connecting to the fastest growing industry of the decade. Now, you may still be on the fence, but these are real partners. One of them, her name's Angie, a mom of three, stay-at-home mom of three. With all those day-to-day errands, kids events, she connected with our affiliate links. 5 months later, she's earning roughly $3,000 a month, and all this is from 2 landing pages to 2 of our domains. She connected to her social media. Maybe she's done some door-to-door, hit some businesses up, maybe has a back end of clients that she already has, but small. But she's doing about $3,000 a month, and that's the residual.
Wow.
So again, it's not a one-off product. They do come back and reorder when they're comfortable with you. Now, there's another angle here. A gentleman by the name of Eric, he's an ex-merchant processor. So he worked around the clock. He wasn't really entirely sure about the space, but he knew that his business contacts had a need for the solution. He ended up launching a full white label platform with us, and he's making about $14,000 a month. So that's 2 success stories. We can range small to large and pretty much handle any size for a customer or for a company that wants to join this partnership.
Okay, so for my listeners who are entrepreneurs or healthcare professionals, what does the business setup process, actually look like and entail for them?
Are you talking about just medical doctors, or are you talking about just any type of business that comes
Just
in?
any type of business, because from what I get, you don't have to be a medical professional to have a
Exactly.
white label telehealth
Let's
business.
say our doctor program, you don't have insurance, and you know what? I would like to get to that. I believe that's on one of my next slides, but I will say this. Our model is for everybody, whether you have a school, you work with a college, automotive, industrial industry, your employees need some sort of incentive to work with you. Do you offer health benefits? A lot of companies don't do that, and that's where we come in to make that transition.
And then just going off of this slide where we see how it's such a huge market opportunity in the next 10, 15 years, what do you think is really driving this momentum in this specific industry?
Well, if you want to move to slide 7.
Slide 7, here we go.
There we
What's
go.
the next slide?
We got some projections right there. Now, people already have heard of Teladoc, Hims and Hers, Amwell. You may have yourself already bought some product online, maybe even Amazon. You bought some vitamins from
Yeah.
there, and let you come up with your own vitamin line. People would love to have melatonin mixed with this. They would love to have, a weight loss remedy comboed with this. So we can develop those nutraceutical brands for somebody that doesn't want to get into the prescription space. So that is an option that we have available. So we have generally 3 options here. We have the urgent care services where your customer could see a doctor 24/7 anywhere. Or you have a model you can plug in to prescribe prescription medications from the comfort of anywhere. They just fill out a quick medical questionnaire. Or there's a quick checkout with a vitamin. You can easily build a Shopify page, add various products of your desire. A lot of people don't know how to get started. So even if, and this is what I'll discuss at our booth next week, is that even if you don't know how to get started, we can help you through that process. It's as simple as providing you a link and start putting that on your social media. We can create QR codes and landing pages, and you choose which medications that you want to provide. It's all plug and play. Very, very easy model to get into. So as you can see here on the slide, it's projecting growth. It's just a huge booming industry. I mean, almost 7x in 10 years. I don't know of any other industry that's
Yeah.
gonna grow that much.
And this is just with the consumer behavior and technology advancement as well, like contributing to people
Exactly.
switching more over to telehealth.
Exactly. All right. So slide 8. So you'd asked this before. Where can you ship? How do you operate a little bit? So we do have all 50 state licenses. So that's not a problem. 24/7. We can call a script into your pharmacy if you have a condition like an earache or a cold. Speak to one of those remote physicians that is state licensed rather quickly. A call center that's dedicated 7 days a week for any customer service issues that you may have, billing questions. So What's important is that I want people to know that they're getting authentic products. Think of us as a seamless engine behind the curtain. We've designed a system so you'll never have to touch the messy parts. Shipping and returns, customer follow-ups, automated reminders to keep patients on track, and retentions. This is very important because when a customer visits the site, is there any sort of follow-up? They may have left at a certain page. My call center, and I stress the call center is very important, I want people to have a good experience, follow up with patients. What went wrong? Let's fix that. Let's get you as a customer and experience what a good model we have. And that's why our Trustpilot review is almost 5,000 reviews. We're at a 4.8 rating. And you look at our competitors, a lot of them don't have phone numbers. They want to just stick to the internet. And, a lot of people still need that
Need
solution
that
of picking
connection.
up the
Yeah.
phone. You need to have that connection.
Yeah.
I think that they're going to fail if you don't have a call center that is really trained on how to deal with this type of behavior, buying pattern.
This is mind-blowing. This is mind-blowing. We, your clients, we get to benefit and leverage your experience, your high rating, your tech, and just have our own telehealth cash business.
And you know what the nice thing about that is that unlike others, we believe that a 50-50 revenue split is worth it with a partner on every sale. You're bringing the customer, and I know how hard that is these days to bring new customers in. Marketing costs are expensive. You may hear companies that say you'll get 10%, 15%, 25%. Those partnerships are available all day long, but 50% is what we provide our partners when they bring in customers. We're working together. We're a family business. We know the hustle, and it's not worth it for us to shift a few points there, take that out of your pocket. We want to put that cash in your pocket, make you comfortable, and make you a lifelong partner. We don't want you to leave.
Well, that's really thoughtful. And I would say it also shows the value, the high value you're offering your clients and the value of your business. If I say so myself, I think it also speaks to how long you've been in the market and shows that you're a person of integrity, which is why you've been successful in this space for so long. It's something I think we need more of in the entrepreneurial space. So that's really great and
I do.
inspiring.
Thank you very much. I do appreciate that. 7 years of nonstop. It gets a little stressful. There are times I wish I could relax a little bit more, but I like the growth. It's almost like in my blood. I want to create a new project, investigate new technologies, look into AI additionally, because it's changed so drastically in the past 2 years.
Oh, yeah.
Heck, in 6 months, it's changed
It
drastically.
changed so quick, so quick. Yes. Is there any specific area of your business where you see AI fitting in and
Absolutely.
improving?
Absolutely. I can't think of one that AI is not involved in.
So
You
that's
know
the
what? Actually,
marketing.
hold on. And AI is not involved in our Christmas parties or birthday celebrations. That's all about it.
That's what
But yes,
okay.
because we do have employees that work remote, but bringing them together, I mean, that's what I really look forward to. That engagement with my staff. That's a fun time. All right. So next slide here now. BidRx is another option that we have. So if people have heard of GoodRx, you print up that promo code for your medication, bring it to your own pharmacy. So now we offer BidRx savings card. So anybody who partners with us has an opportunity to tie into this system and receive a card where they can receive a little bit of the money off every transaction that's done of the pharmacy, so that code ties back to you. So that is an additional option that we provide here with Telehealth Cash. But what's great about it is that it's excellent for like business travelers. We can't afford to be stuck in hotel rooms, especially when you're visiting conferences, conventions. I've been there. Whose kid spikes a fever over the weekend, cannot get an appointment with a doctor. I've been there as well. Employees without health benefits, what do you offer them? I mentioned that before. Why not
Yes, you
offer
did.
them a fast access to healthcare? And that's what the combination of the Our Doctor BidRx model is. And that's what we'll be
Okay.
presenting as well at the show as another option for partnership.
So it's two options here, the online care from a doctor as well as being able to fill your prescriptions online
Correct.
and get medication online.
Correct.
Do you see telehealth ever replacing traditional clinics, or you see becoming more of a hybrid care model? When you
You
think of
know,
it, what do you think?
traditional telehealth
Clinics.
can't dive into but you know what? I actually take that back. There are surgeries that are happening right now using AI technology.
Oh,
However, there are still those specialists you want to have that visit with them before you go in for a major operation. So yes, I do think that the future holds, even for a major surgery, that you'll never have to go visit a
a
doctor's
doctor.
office. You'll have some sort of facility that will be all electronic, give you the guidance, hit the surgery room, and there's someone remote telling you what to do. That's coming.
That's mind-blowing to think about how things just change so quick as we evolve and we time goes by.
Oh, you're telling me. Maybe we'll see this in the next 5 years, but I could be wrong. It could be in the next 24 months. If you attend some of health fairs, it'll open your eyes with some of
Mm,
the new technologies that
what's
are out there,
happening?
because it's incredible. So I did talk about slide 10 here a little bit. Well, again, we help businesses. It tells a little bit more about our credentials. Let's skip to slide 11. So wellness products, right? So let me be clear. Telehealth cash isn't just vitamins or testosterone therapies. We got custom compounds, troches, creams, peptides, and that's just the tip of the iceberg. Now, the big question is, how can an entrepreneur or medical professional enter this market without getting
Hmm.
buried in costs, compliance, or red tape?
Yeah.
You really have three options. You can build your own model. Yes, you'll have total control, but getting started, costs are outrageous. On top of that, you'll need to navigate the legal maze, build infrastructure, assemble teams. This approach can take months or even years, and by that
Right.
time you're ready, the market opportunity may have already passed you by. Or you can join a traditional affiliate program. Easy to start, but you're building somebody else's
That's the
brand,
business.
right? That's not what we want. We want you to capitalize with the customers you're bringing in and go down your own path. But let us help you fulfillment. Let us help you with your guidance. Let us handle the hard stuff. Now, if you partner with Telehealth Cash, with us, you build a turnkey white label clean solution of your own brand. Let us handle everything for you. Now, this isn't just the easiest path, it's the fast track to market. You move quickly, you cut risk, and leverage systems that have been winning for decades. We offer many products, right? As you could see here, you could pick one of them, you could pick them all. You control which category appears on your website. We can add promo codes and help you target your audience. Some options you don't see: mental health. We have mental health solutions, pet health, animals, and urgent care to treat several conditions that are not listed here as well. So would like for everybody to know that we are available. My team here, our specialists, if you have any questions about how to get started in this industry. Now, using licensed pharmacies, I just want to jump back into compliance a little bit, because there's a lot of rogue pharmacy out there. A lot of people are still not certain that they're getting genuine product. So it's important that everyone knows that every state enforces strict guidelines to ensure prescription medications are dispensed safely and accurately. This means every medication must carry an NDC code for traceability, correct labeling, dosage, and warnings. Legitimate pharmacies also follow chain of custody standards, maintain temperature controlled storage, and log every fulfillment for audit readiness. Partnering with unlicensed or shortcut providers exposes your business to massive liability, FDA action, and patient harm. You don't want that. Partnering with licensed pharmacies, on the other hand, guarantees compliance, safeguards, and most importantly, keeps patients safe. All right, so you don't want to cut corners.
Yeah. Definitely
Now
with a
let's
business like this, you don't want to do that.
definitely not.
I noticed with the licenses you had mentioned the 50 states. So I'm assuming for now, telehealth cash it's going to be mainly operating in the United States of
That's
America.
correct. We are expanding to Canada as we speak. I believe we're going to test launch a CA.E drugstore in Canada. I
Okay.
am familiar with a few players in Canada. You may have heard of them, the Phoenix. There's some other locations out of BC. BC seems to be opening up quicker in telemedicine, and Toronto faster than I'm seeing in Canada. So BC, Toronto are where I may be attending and some shows next year. All right, so slide 13. This is it. I mean, I'm gonna wrap things up because I know that this is quite long. So who exactly is perfect for telehealth cash? Small businesses, potential employees, and ask, do you offer medical benefits? You can now say yes using our model without going the traditional insurance route. Medical practices, for those ready to expand without reinventing the wheel. Turn your operation into 24/7, not just the traditional brick and mortar. And most importantly, the entrepreneurs, the visionaries, I like to call them. They're looking to diversify income streams and tap into that booming market right away. But here's the kicker, and this is very important. This isn't a one-off sale, as I mentioned before. Healthcare and telemedicine is reoccurring. Patients come back again and again for ongoing care, prescriptions, and support. What keeps them loyal are generally four things: fair pricing, fast delivery, exceptional service, and authentic products. Now, if you hit all four of these, you're going to build a relationship that lasts. So how do you actually begin? Again, 4 steps: request a partner kit, choose your model, promote top products, and then track your results. And the average transaction is quite sizable. On average, each transaction, a partner will make about $56 per order, which turns to an average lifetime income stream of about $250 and higher. And lastly, we're going to close with this. Telehealth cash is not just another side hustle. It's a chance to own your own fully operational healthcare business under your own brand, powered by Secure Medical, over 27 years in the business. That's all I have today.
Well, thank you so much, Kyle. You've seen this industry evolve from dial-up internet and using faxing machines to virtual medicine in the cloud and iPhones and all that technological advancement. And a lot of you may not know, but Kyle is actually giving us a presentation for his upcoming conference in Vegas, which is happening next week. So thank you so much for this, Kyle. As you prepare for your upcoming conference, what's your personal vision for Secure Medical and telehealth cash in shaping the next era of healthcare?
So we're hitting a convention. It's called a white label convention. I'm hoping to learn something there as well, maybe something that we can bring in-house. But I'm hoping to deliver my message. I want people to know that entering this space is easy now. As long as you partner with a company you can trust and turn your current business or your vision into reality quickly.
Well, thank you so much, Kyle. Thank you for joining me today. Your story is a powerful reminder that innovation starts with vision, not just technology. For those listening, if today's conversation inspired you to think differently about telemedicine, make sure to check out securemedical.com and telehealth cash. I will be linking Kyle's LinkedIn as well in the comments if you want to connect with him on LinkedIn. As always, if you enjoyed this episode, make sure you subscribe and share with a colleague or entrepreneur that needs to hear this. I'm Laura, and this is another episode of the ClintrixAI Podcast, where innovation meets healthcare. Bye, everyone.
Thank you very much.